There's no doubt that breast augmentation has always been a very highly sought after procedure. Just recently, the FDA approved in 2024 the new implant with a nano-texture on top, and it's called Motiva. The big advantage of that type of implant is that it is decreasing the rate of capsular contracture. In Austin, I would say trend has always been to be patient. Their main motive was to be natural, yet have an enhancement. But be natural. I think people like in the past probably wanted to be more like full C, D, and now they're more like, smaller B, C. And also just the lifestyle that patients have now. A lot of people do yoga, do Pilates. So having like large implants, right, obviously hindered your activities to a certain extent, right? The patient just want to be more free and be comfortable in their body. I'm very honest with my patient. I always tell them exactly what the post-op recovery will be. And I think that's one thing that I think my patient really appreciate. We do surgery, we help them throughout the whole post-operative care afterward. They have the proper medication, the proper support. We make sure they have like support at home too. That is extremely crucial to achieve a good recovery. But I think a lot of people, like especially on the liposuction in the past, people thought that there was a lunch procedure, right? So you get liposuction at lunchtime, and then you would be back at work in the afternoon. And the reality is, liposuction is a pretty aggressive procedure, depending on the amount that you're going to be removing of fat. So therefore, I think educating your patient so they have a very clear understanding of what the surgery will be for their specific needs, and also discussing thoroughly the post-operative course and being there for them, right? And complications do occur, even to the best surgeon. And the reality is, like, you just want to make sure you recognize them early, you treat them, and we have a good, effective communication in the post-operative course and being available, right? So our office, from our physician assistant to me, we're always available a phone call away.